How to treat mouth sores from chemotherapy. If you or someone you know is undergoing chemotherapy, you might notice painful mouth sores that can make eating and talking uncomfortable. These sores, called oral mucositis, are common side effects of cancer treatments like those used for testicular, cervical, or other reproductive cancers. While they can be bothersome, there are safe, evidence-based ways to manage and reduce their impact. First, maintaining good oral hygiene is essential. Gently brushing the teeth with a soft bristle toothbrush or using a cotton swab or sponge designed for oral care can help remove food particles and bacteria. It's best to brush after meals and before bed. Rinsing the mouth frequently with mild solutions like plain water, a saline rinse made with a 1/4 teaspoon of salt in a cup of water, or a diluted hydrogen peroxide solution can help soothe and clean the sores. Avoid alcohol-based mouthwashes, as they can irritate the mucosa and worsen discomfort. Keeping the mouth moist is also important. Sipping water regularly or using water-soluble lubricating gels can prevent dryness and help with healing. Replacing toothbrushes often, ideally every few weeks, reduces bacterial buildup that could lead to infection. Pain relief is another key part of treatment. Topical anesthetic rinses or gels containing lidocaine can numb sore areas temporarily, making it easier to eat or brush. If pain is severe, your healthcare provider might prescribe pain medications, but it's best to avoid non-steroidal anti-inflammatory drugs like aspirin during chemotherapy unless advised by your doctor, because they can increase bleeding risk. In some cases, corticosteroid mouth rinses, such as dexamethasone or systemic pain control, may be used under medical supervision to help manage severe discomfort. Preventing infection is crucial. If mouth sores become infected, your healthcare team might prescribe antibiotic mouth rinses or systemic antibiotics. Good oral hygiene practices help reduce this risk. Some supportive treatments can also help minimize the severity of mouth sores. For example, sucking on ice chips during certain chemotherapy infusions, such as with melphalan or 5-fluorouracil, can constrict blood vessels and limit drug exposure to the mouth tissues, reducing soreness. In high-dose chemotherapy cases, drugs like palifermin, a growth factor, may be used to promote healing of the oral mucosa. Zinc supplements have shown some promise in reducing pain and promoting healing, especially during radiation therapy, and might be considered in some cases. Nutritional support is vital. Soft, moist foods and possibly enteral nutrition can help if swallowing becomes difficult due to pain. It's also wise to avoid irritants that can worsen mouth sores. Spicy, acidic, or rough-textured foods should be minimized. Tobacco and alcohol can delay healing and should be avoided as well. Regular communication with your healthcare team is important to monitor symptoms and adjust treatments as needed. In the context of chemotherapy for testicular, cervical, and reproductive cancers, these strategies are supported by established medical guidelines and aim to make the treatment process more comfortable. Always consult your healthcare provider for personalized advice, especially if symptoms worsen or do not improve. Remember, managing mouth sores effectively can help you stay nourished, reduce infection risk, and maintain your quality of life during treatment.